integrity
Anvil.
of the hip to see if there's a fracture or some other problem with the bony part of the hip. The Anvil test is kind of a fracture screen for the hip, and we have to put some percussive force through the entire leg. So, no, it's fine. I'll do it with the boot on. If Michelle had stilettos on, I'd probably have to take those. Somebody asked, what if your patient has really high heels? I generally haven't had patients with hip pain come in with like super high heels. It's probably self-selecting. Like, it's going to be hard to like limp and keep yourself up on, like we're talking, 6, 8 inches. And if that were the case, I'd just take them off, whack on their heel a little bit. So we tell the patients, I'm going to be tapping on your heel. And the Anvil test really is a good thump on the bottom of the heel to put that force up through the leg. But I do it in 3 stages. 1 light, 1 medium, and 1 hard. Because if they have like pain in their hip with a very light amount of percussion, I'm done. They could have a fractured hip. If they have pain without light or medium, then we're still good. I can give it a good whack, and if that causes pain, then it's probably less than like a fracture of the hip. Probably some other thing going on. So we keep the foot in neutral, and the foot in neutral means dorsiflex about 15 degrees. And then with my palm or with the ridge of my hypothenar eminence, tap on the heel. I usually do it with my palm so I can watch the patient. But for some of you that's going to hurt, so do it with this. Never like this. This is dumb. I had a bunch of people do that in the class, and they were like, you didn't tell us not to. Like, so I don't know. So in the explanation, did it seem like I was going to punch the patient? When I show it, I definitely didn't show that, because that hurts. People are like, I don't like this test, it hurts my knuckles. Please don't punch each other. So try it both ways. A lot of you won't like the palm, because that kind of feels a little harsh on your hand. Use this part, not this part. It's a little bit more knuckly on the thumb side of things than it is on the hypothenar side of things. So we had to put a little bit of pressure, and that went all the way through her leg. I could tell because her upper body moved a little bit. And that wasn't that hard. A little bit harder. Are you pain with that? And then a good whack. Are you pain with that? No, we're good. Done with Anvil test.